Because Zimbabwe is faced with blood scarcity amid the impact of COVID-19, but a number of blood donors are out to remedy the situation, while the country relies heavily on imported blood to support patients. But due to the limited movements of goods and services, many health facilities are left in center of blood shortage. Health workers are hopeful that the latest offer would go a long way in improving the challenging situations in health centers. Here's more details of that.
A small prick begins a flow of blood which could be the difference between life and death for some.
If you think about it, this is one of the only ways you can actually save someone's life without doing a lot. Like you don't actively have to do anything, but the effects are incredible.
But recently, donors haven't been able to give blood and the equipment to process it has been held up.
Due to COVID-19 and the limited cargo services, we had our critical consumables which were coming from outside the country and got delayed for about 2 weeks. And this greatly affected us because the consignment that we were expecting was carrying things such as the test kits, which are very critical. Without them, you're not able to test for the blood.
Deliveries to public hospitals have been suspended, endangering some patients like delivering mothers who may need transfusion.
The stocks are limited. So you find that the stock which is available may be for very, very critical cases. But now because the consumables have come in, we should see that improving now because we're able to then improve in terms of our supply. And eventually maybe in the coming week we are back at, above 90% or so supply of blood to the hospitals.
Zimbabwe is also keen to shore up a dwindling number of blood donors. These are the names of centurions, people who've made 100 blood donations or more. To reach this milestone requires at least 25 years, and so that's why the National Blood Service is always reaching out to younger donors and is now being encouraged to use the platforms on which they are most active.
A lot of kids spend time on social media and stuff like that. I think if there was advertising done on there, it wouldn't. So maybe even if it didn't attract new people, it would remind people like me and my friends who have done it before that, hey, it's been a while. Why don't you come by and give blood? And, you're always scrolling through Instagram. Seeing something like that would remind you, I think.
A revamped outreach plan will also see the blood service go into rural areas to attract new donors.